Hello everyone, welcome back to my YouTube channel. Today video is about the anatomy of the vertebral column. I have broken down the contents of my video. First of all, I will describe the basic structure of the different regions of the vertebral column. Then I will tell you about the nerve supply and blood supply of the vertebral column. And then I will tell you about the movements that are possible at the different regions of a vertebral column. So first of all, let's start with the basic structure of the vertebral column. Everyone, now talking about the basic structure of a vertebral column. As you know that the vertebral column is divided into 5 different sections. Starting from top to bottom, first there comes the cervical region, then the thoracic region, then the lumbar region, then the sacral region, and then the coccyx. I will write down their names. The first region that comes is the cervical region. It consists of about 7 vertebrae. After the cervical region, there is the thoracic region. The thoracic region consists of 12 thoracic vertebrae. After the thoracic region, there is the region of the lower back, which is also known as the lumbar region. The lumbar region consists of 5 vertebrae. After the lumbar region, there is the sacral region. It consists of 5 vertebrae, but these 5 vertebrae are fused. And after the sacral region, there is the region of coccyx. It consists of 4 vertebrae and they are also fused. So the lower 2 regions are fused, and total these make up about 33 bones. So if anyone asks you that a vertebral column consists of how many bones, so the answer is 33. I will again repeat, there are 5 different sections starting from top to bottom. This one is the cervical region. Then comes the thoracic region. The thoracic region consists of the most vertebrae that any region has. Then comes the lumbar region, which is the region of lower back. And then this is the region of the sacral vertebrae. And then this is the region of coccyx. So together these 5 sections make up our backbone or the vertebra. Now talking about the structure of one specific vertebra, I have drawn here the lumbar body L3. The basic structure of vertebrae are same, but there are slight alterations at the different levels of the vertebral column. So talking about first the basic structure of a vertebra. The vertebra always consists of a body. Then there are the vertebral arches. And then there are the processes. Okay, so each vertebra consists of these 3 parts: the body, the vertebral arches, and the processes. So where are these structures in here? I will just show you. For the first part of the vertebra, which is head shaped, this is known as the body of a vertebra. So this region right here, which is head shaped, this is known as the body of a vertebra. After the body, this region, is known as the area of the vertebral arches. It consists of 2 parts. The first part is right here where the body ends. This part is known as the pedicles. And the part right here, these are known as lamina. Okay, so the vertebral arches consist of 2 parts, the pedicles and the lamina, which are here and here. After that, there are the processes. So there are these 2 processes, the transverse process and the spinous process. So these parts which are protruded outside like arms and this is the pointy part. This pointy part is known as the spinous process, and these which are arm like these are known as the transverse process. So there is a hollow structure right here. So this hollow structure is known as the vertebral canal. So you guys should think which structure should pass through the vertebral canal. A very important structure which is known as the spinal cord. So the spinal cord passes through the vertebral canal. One of the most important function of the vertebral column is to protect the spinal cord, and it passes right through it. So again I will revise the basic structure of a vertebra. Each vertebra consists of a body, a vertebral arches and processes. So the first part which comes, which is the head-like part, it is known as the body of a vertebra. After there is this region which is known as vertebral arches. It consists of two parts, the pedicles and the lamina, and after there are the processes. This one is known as the transverse process and this one is known as the spinous process. So this is the basic structure of a one vertebra. Now talking about the nerve supply and the blood supply of the vertebral column. The vertebral column is supplied by the different branches of the spinal nerves which arise from the spinal cord. Talking about the blood supply of the vertebral column, so the different regions of the vertebral column gets its blood supply from different arteries. So first talking about the cervical region, the cervical region gets its arterial supply from the occipital artery. The thoracic region gets its arterial supply from the posterior intercostal arteries. The lumbar region gets its arterial supply from the lumbar artery. And the sacral region gets its arterial supply from the lateral sacral artery. So the nerve supply is from the branches of the spinal nerves. The cervical region gets its arterial supply from the occipital artery. The thoracic region gets its arterial supply from the posterior intercostal arteries. The lumbar region gets its arterial supply from the lumbar artery, and the sacral region gets its arterial supply from the lateral sacral. We were now talking about the different movements possible at the vertebral column. Almost every type of movement is possible in the vertebral column, but it varies according to the region. For example, sacral and coccyx region, they allow some degree of flexion and extension movement, while the cervical region allows a greater degree of motion. So there are different types of motion or movement that can occur. The nodding movement occurs at the cervical vertebra C1. Then there is sideways head movement, which is possible at C2. Then there is the flexion and extension, which is possible at almost every vertebra. Then there is the lateral flexion, which is also possible at around each level. And then there is rotation, which is also possible. So these are the different type of movements which can occur at the different regions of the vertebral column, but they vary according to the different regions. Some regions allow greater degree of motion, while some allow less degree of movements. Okay everyone, that was all from the video. I hope you liked my video. If you have any queries, you can ask me in the comment section. If you like my video, give it a thumbs up. and kindly subscribe to my YouTube channel Medical Knowledge. Thank you for watching. Have a nice day.